So we filed a lawsuit in Superior Court that we demanded a real administrative law judge. 2 days before the hearing in Superior Court to make that decision, the medical board conceded to me and gave me an administrative law judge. So I asked my attorney, I said, why did they wait 2 days before and do this? And my attorney said, they don't want this to go to Superior Court. They're trying to decide which is the lesser of two evils for them. If they go to Superior Court, a real judge starts looking at everything. They would rather take the chances with an administrative law judge in their own court, in their own administrative law court, as opposed to having a Superior Court judge, a real judge that's going to really look at it in his own court. So although, administrative law judge is a real judge, obviously, too, but they didn't want me to have an administrative law judge. But when it came down to the fact that it's either administrative law judge or a Superior Court judge, they said, we'll give him the administrative law judge. And again, even though whatever the administrative law judge finds, the medical board doesn't have to adhere to that standard. They can rule whatever. And I already told my staff, no matter what happens, they're going to find me guilty of something, which is fine. I just want to get it out of their court into a real court. So the fact is that if I've done something wrong, they should take my license. They haven't taken my license, so that means one of two things. Either one, they're lying. After 2 years, they're either lying or they're completely inept and incompetent, and in 2 years they couldn't take my license. It's either they're a liar or they're incompetent, and so those are the two choices that, as far as I'm concerned, those are the only two options that they have. They have essentially what it comes down to is that I am a source of pain on their side because I am doing things and getting results that embarrasses them because they can't get it. There's nobody in the state of North Carolina that has patients coming from 35 different countries. Nobody. They don't have anybody in the state of North Carolina that has patients coming from 42 states. And so they can't stop me based on our results, so they start blowing this thing about, standard of care. And I have openly said that I don't practice a standard of care. I've never done anything standard in my life. I'm not about to start now. They're trying to make it, convoluted. And we had patients with stage 4 cancer that were given 6 months to live testify on my behalf 5-6 years after they were supposed to have been dead. The board said that had nothing to do with it.
See, and I want the audience to understand that this has been going on for more than 100 years to doctors just like you, doctors that turn to alternative methods outside of the pharmaceutical paradigm and are effectively healing people, just like you said, to their embarrassment. Because this is a huge thorn in the side of the pharmaceuticals, because they no longer can control the healing according to what they determine. And it calls to mind, I've got this book, Politics and Healing, and it just...
Great book by Dan Haley.
Yeah. Henry Hoxsey, arrested 125 times within 16 months after this character, Morris Fishbein, offers him a deal. This, just for the audience, this Henry Hoxsey, he has this natural therapy for cancer, and he's curing people with it. Well, because he's not a big pharmaceutical and he's not going to pay advertising dollars to the JAMA, the Journal of American Medical Association, this Morris Fishbein, who runs both the American Medical Association and the JAMA, he's basically the gatekeeper of all medical information. He was the one that got to decide which drugs get approved and which ones don't. And if they couldn't slip him some advertising dollars or buy him off, then he would put the stop on it. And so this Henry Hoxsey, doctor guy, healing people right and left, he went after him because he didn't have any money to feed him, and he wasn't going to. Then he came to him and he offered, Fishbein offered him, and he said, well, okay, we'll approve your method, your therapy, but we want 100% of the profits and control for the first 9 years. After that, we'll give you 10% of the profits, if we agree that it's actually effective. Well, Hoxsey just completely threw it out and said, give me a break, no way. And, it was just a witch hunt. They just hounded the man, 125 arrests in 16 months. And he kept getting off every time. He kept getting off, and the same story. It sounds like just like what you've been through. The people would come and testify, in his defense. And like even one of the guys that was consistently pulled up to put the case against him, he eventually cured his brother of cancer. And then he quit as the DA and started serving as his defense attorney. And then things kind of turned around. And in fact, I think he's the one that took this Morris Fishbein character down because he ended up bringing him on the stand, and he had to admit that he failed anatomy in medical school and that he never practiced medicine a single day in his life. Yet here he was in charge 100% of the AMA and the JAMA, and, basically the gatekeeper of American medicine for 25 years, a quarter of a century. And that's what the people need to understand, that, at one time it wasn't a medical mafia, but, this character got in and it all went sour, and it's just been going downhill ever since. And, these stories, we could tell hundreds of these stories. I mean, I've heard of stories of people with ozone therapy, which you do, which I'd like you to talk about, being literally bludgeoned to death, because they did not want people to know about ozone therapy. That was in Ed McCabe's book, Flood Your Body with Oxygen, because they just don't want people to know that it's really quite simple and effective, and it's not that expensive, so they can't corner the market on it. It's not a...
I think a lot of it has to do with that the doctors, the lower doctors, they don't know any better. This has been bred into them, so they think that they're really doing the right thing. The hierarchy, they know the truth. They want to control the monopoly. They don't want anything that's, one, not patentable, and two, that can reduce the profits of the pharmaceutical industry. I mean, perfect example is looking at cholesterol medication and cholesterol levels. When I graduated from medical school in 1991, the normal cholesterol was, if you had a 275 or lower, cholesterol was considered normal. Well, then it dropped down to 250, then it went down to, I think, 230, then down to 225, then down to 200. Now, if you have a cholesterol above 175, they're recommending statin drugs.
Right.
Now, the problem is that we know that, first of all, the statin drugs, and I'm just using this as one example of many drugs out there, but we know that the statin drugs, there's a higher incidence of liver cancer in these patients. We know also clearly that the literature shows that the statin drugs deplete the body of coenzyme Q10, which is essentially ubiquinone is what that is, and it's one of the cofactors found in the mitochondria for the body to be able to make energy, adenosine triphosphate, which is how we are able to actually function. And the coenzyme Q10 is depleted when you take a statin drug. So the research that was done on the statin drug said that you must take coenzyme Q10 if you're going to be taking statin drugs, because the statin drugs would deplete this level in the body, and that can be very dangerous. But all the recommendations on the medications, when they're made to the doctors, nobody gives coenzyme Q10 because it's not described in the literature. And when you ask them why, nobody knows. It's like, well, we don't know anything about that. Well, when you look at the research, it's clearly stated in there. The reason that when the pharmaceutical industries were questioned as to this reason, why isn't the ubiquinone, why isn't the coenzyme Q10 recommended along with the statin drugs, as the research shows, the answer is because it's too expensive for the patients. So it's too expensive for the patient to take the coenzyme Q10, which is allowing the body to work correctly, but it's not too expensive to give them these expensive statin drugs, which in themselves have been shown they may have some minor reduction in lipids, but more than half the people that are getting heart disease and having heart attacks right now have totally normal cholesterol lipid levels. Totally normal. And half the people that have high lipid levels have no history of heart disease. So we know that it's not a cholesterol issue, and yet it's still propagated and perpetuated as if it is a cholesterol issue. And so, I mean, bears have cholesterol levels in the 700-800s. Bears don't die of heart attacks. Cholesterol is almost like a lubricant that to increase in the blood to protect the body, to make the cells be able to pass to pass through the vessels easier. It's like trying to make everything more slippery. It's almost a compensatory type response. And what are we doing? We give people statin drugs, and it's just ridiculous. The system is very, very messed up.
So you do practice ozone and also hydrogen peroxide therapies in your clinic, correct?
I do anything and everything that will make a person get better.
Okay. Would you be willing to share any any interesting stories on that? I just happen to love oxygen therapies and think they need more more exposure.
Well, I'll tell you that if somebody ever gets the flu or H1N1, it'll take us about 24 to 36 hours to knock it out, where it's not ever been. In fact, a funny story. Desiree got the flu not last week, but the week before. She got the flu shot to prevent the flu, and she gets the flu. Her body was aching. She was, headache, vomiting, this typical flu. It lasted in her for probably about 24 hours. She was weak for the next couple of days, but she wasn't throwing up. She didn't have any more body aches. She didn't have any more headaches, but she was weak. She was tired. But the oxidative therapies are what wipe out the flu, any kind of virus. It really is very beneficial for that.
Right, yeah. The ozone, I mean, there's a documentary, and I hope to do an interview with Jeffrey Rogers, who made the documentary Ozone and the Politics of Medicine, and he goes into it, I think it took him, 7 years to make this documentary, and he says, he goes all around the world showing all the amazing benefits of ozone, and it's got, 7 in 1 million, out of 1 million, so 0.0007% side effect. And the side effect would be super, super mild. I mean, not even remotely life-threatening. Yet, the FDA has referred to it as a toxic gas.